Hi.
Yep, you've been there. Or because you're watching this video, you will experience this soon. An unbelievably dashing patient walks your way, and you're responsible for taking this patient's hypertension reading in an efficient yet effective manner. We hope this instructional video will serve as a foundational example of the key tenets to implement when you conduct your own hypertension readings. And we're excited to see how you can alter this example to fit your own service persona. Without further ado, let's get going.
Hi.
I'm Michael.
When a service recipient approaches you at a health site or health fair for hypertension readings, always make sure to greet them with a smile. It really helps.
Nice to meet you. I'm Quynh.
Can I take a seat? Cool.
Introduce yourself as a volunteer, and for health sites, have them sign a waiver before doing anything. Explain to the patient what it means to have a hypertension screening. In other words, it's a measurement of your blood pressure. Reassure them that they should only feel a slight squeeze of their arms, and that you will stop it at any time if they say that it hurts.
So today we're gonna be doing your hypertension. So what that means is we're gonna check your blood pressure using this machine.
Perfect.
It's not gonna hurt anything. You're just gonna feel a little squeeze.
Okay.
Before the screening, make sure to ask the patient whether they had exercised or drank coffee, as that will slightly alter their results. Regardless of their answer, you can still take their blood pressure.
Alright, so have you either drank coffee or exercised today?
I drank some coffee today, and also I exercised in the morning.
Okay, so what that would mean is that your scores may be a little bit off, but that's fine because we can still check it today. Is that okay?
That's perfect.
Okay.
Make sure that the patient takes off their jacket or rolls up their sleeves before the screening, as this will increase the machine's accuracy. However, they are not required to roll up their sleeves if they are made of thin fabric. Just use your best judgment to decide what would be best for each individual patient.
Can you please either roll off your sleeve or take off your jacket?
Sure. Sorry. It's taking me a bit.
To ensure the best reading, make sure the patient's posture is correct. Their feet must be uncrossed, their back straight, and their body relaxed, as this model does so well. Connect the gray cord to the blood pressure machine, and the setup is done. It's that simple. Now it's time to perform the screening. Make sure that when you're putting the blood pressure cuff onto the patient that their arms are positioned in a way such that their palms are facing upwards. It doesn't matter which arm you choose, but the left arm tends to be slightly more accurate given its proximity to the heart. When putting the cuff onto the patient's upper forearm, which is above the elbow, have the gray cord situated so that it is facing outwards along the brachial artery, which lines up with their pinky. Ensure that the black cuff wraps around the patient in a way that is tight enough so that solely 2 fingers can snugly fit underneath. Here's a picture of the setup of the blood pressure cuff if you ever need something to refer back to. The particular patient modeled in this photo does have a smaller arm, so it may be appropriate to use a kid's blood pressure cuff in this situation. The blood pressure machine begins by increasing pressure in the cuff, and these increasing numbers may cause anxiety to patients who are both unaware of what the numbers mean and unaware of how the machine operates. So it's best to make sure that before you start screening, do face the blood pressure machine away from the patient. Kindly tell the patient to refrain from speaking during the screening, as this will also alter the results. Start the machine and wait until it finishes. When the machine finishes its job, first take off the patient's blood pressure cuff before informing them of their results. Tell them the numbers they received for their systolic and diastolic values, then explain to them what range they fell in. While you will always have a chart to help you interpret these results, it doesn't hurt to have an idea on what these numbers mean. Remember that if the 2 numbers are in 2 different ranges, take the higher range in every case. We like to be conservative where we can. Please note that because you are a volunteer, you cannot diagnose the patients. However, you can certainly recommend them to either change or continue their diet and lifestyle based on their hypertension readings, and to visit the doctor if they have any other further questions. And that's really all there is to it. We hope that this video has been helpful in instilling a newfound confidence in your own hypertension reading abilities. We want to make sure that the hypertension reading part of your volunteer experience is seamless and smooth, so that you can focus on the other rewarding parts of service. conversing with the patients, and visualizing your role in this population's long-term health outcomes. Thanks for watching, and if you like this video, please like, comment, and subscribe for more future content from VCH's Health Site.